Welcome to week 11. So for this week, we'll be talking about the nervous system. And so at the end of this week's short module, you should be able to define these items here, these 6 items. So for one, you should be able to define a stroke, outline the significance of timely intervention in the event of a stroke. So what that means is a lot of facilities have what's called a door to image time. I think I mentioned this a couple weeks ago. That just means the time it takes for the CAT scan to be done and the first report to be, or the initial report to be available to the practitioners, right? So they time it from the patient gets through the door to when the initial report is available, and we try to keep that to about 30 minutes for a lot of institutions. You should be able to briefly describe why brain infarction impacts opposing limbs. So if there's a stroke that is evident on the left side, why does it impact the right side of the body, and vice versa? You should be able to list and describe some signs and symptoms of a stroke. You should be able to list medical interventions that may limit or prevent the chance of permanent neurological damage after a stroke. And obviously list the brain lobes, which should be pretty straightforward since you've been doing skull anatomy or it's available to you at your school. All right. Then there are 2 lectures. The first one is both on the nervous system, but you should watch it in this order: the first lecture and the second lecture. And then there are 4 videos for you to look at. They're both talking about the different examples of the Broca's area and so on and so forth, the different brain infarctions or brain deficiencies, the speech centers and so on. All right, short videos. All right, so we'll look at the 2 videos, right? The 2 PowerPoints right now. We'll start with the first one. It just has about 11 slides. So we'll talk about the nervous system. We'll start there by talking about the PNS and the CNS. PNS stands for peripheral nervous system, and the CNS stands for central nervous system. The central nervous system is just the brain and the spinal cord, and the peripheral is everything else. Why is it significant? Well, there are nerve fibers that communicate sensory information through your eyes, from your nose, from your skin, and so on, and that gets communicated to your CNS, and then your brain and spinal cord sends out information, motor information, as a response. Should you fight? Should you run away? Should you pull away? That kind of thing. What should you do about it? And that's how this communication happens, like a communication highway to and from your CNS, right, via your peripheral nervous system. This is what a neuron looks like, right? So when you see when you hear about myelin sheath, white matter, gray matter, all of which are described on brain CAT scans, this is what's happening. So you can see the gray matter is the cell body, and the white matter is so called because of the myelin sheath that's on the axon, right? So again, the body is the gray matter, and the white matter is the myelin sheath that's around the axon, right? So I think it's kind of fatty sheet, right? So that's the cell body, that's the axon. Right, but interesting fact here is that the cell body and the axon locations are switched, which we'll look at in the next slide. They're switched in the brain versus the spinal cord. So in the brain, we can see, now remember, the gray matter is the cell body. So in the brain, we can see that the gray matter is towards the outside of the brain. You can see that there, right? And then the white matter is towards the center for the brain. But on the spinal cord, this is the spinal cord here on the left. On the spinal cord, we can see the cell body is now towards the center, and the white matter, which would be the axon, would be towards the periphery or the outsides of the spinal cord. The theory is, as far as I can remember, it is just a matter of design, I guess. It's more functional. If the axons are sending sensory and motor information, that it will be closer to the periphery of the cell body for the spinal cord. But for the brain, not so much, because that it's receiving that information from the spinal cord and then sending it the same way. Right, so it's not like you have hands on your head, but you got hands coming off of your body down here, and the spinal cord runs through the rest of your body. All right. In any case, you should know that the gray and white matter are switched their positions in the brain. The gray matter, the body of the body of the neurons, are towards the periphery, the outside of the brain, generally speaking, and the white matter is on the inside. That's for the brain. For the spinal cord, it's the opposite. All right. So for the brain lobes, these are pretty easy to remember because they are named for the bones that they're underneath, are the bones that are protecting them. So the frontal lobe will be protected by the frontal bone, temporal lobe, temporal bone, and so on and so forth. There's no cerebellar bone, but there's a cerebellar lobe. It's under here, and then there's brain stem. These functions are not all exclusive, right? So you can have an injury to one part of your brain and it impacts one of these other functions. However, these are general. These are general functions that you can say. We can say, for example, your occipital lobe is primarily for sight, but not the exclusive, right? So if you hit the back of your head, like I did when I was as a kid, you can have a temporary loss of vision kind of thing, right? Frontal lobe, we could say, is for thinking, behavior. There's a story of a man many years ago that was impaled by I think a metal rod, and that his personality changed, and the doctors couldn't figure it out. And according to folklore, the reason they figured it out, they correlated the injury to his frontal lobe to his sudden change of personality. That's what the folklore says. I'm pretty sure the scientific explanation is way more in depth than that. All right, and the temporal lobe, well, that's what houses the ear and so on, right? So we can say the temporal lobe, pretty easy, is for hearing. Other functions will be learning and feelings and so on, right? But again, just remember, some of these functions overlap, right? The parietal lobe, we can say, is for language and touch, right? We have a precentral cortex, the central cortex, precentral gyrus, and a postcentral gyrus. And these are important for touch, right about here. And the cerebellum, we could say, is for balance and coordination. And for breathing, these control your important involuntary functions such as breathing, heart rate, body temperature, and so on. That's a brainstem. All right. All right. So looking at some abnormalities here, which can happen that impact the parts of the head. Acoustic neuroma is just a tumor of the inner ear. You can see in here the malleus incus and stapes, the bones of the inner ear, which you've learned, and the cochlea and so on. And then there's a tumor. Acoustic neuroma is just a tumor of the inner ear. It's a lot of problems. It causes a lot of problems because it can then, you can see here squeezing or encroaching on the brainstem. And the brainstem, if you can remember, is important for your involuntary functions. Well, if you have acoustic neuroma, you can have problems that impact those involuntary functions for which the brainstem is an integral part of, right? And then we can have a stroke. So stroke generally is an interruption of blood supply to the brain, which causes damage. If you think of a bucket that's being filled with water, right? If you think of a bucket that's being filled with water, the bucket the holes that's filling it can either be nicked, meaning water is now leaking out of that hose, which we call a hemorrhagic stroke, or the hose can be kinked. There's a block in the hose, and then we can call it a ischemic stroke. Ischemic stroke, right? By the way, the difference between an embolus and a thrombus, one of these is mobile, right? So an embolus is just a moving clot, a clot that has moved. A thrombus is just a stationary clot that hasn't moved. So pulmonary embolism is a clot that's broken off, by the way, that's gone now to the lung. So you can have a clot that's broken off somewhere else and it continues on to the brain, and it can cause a stroke. I mean, you can have stroke-like symptoms. All right, the signs and symptoms may vary. You've probably heard of this, where you have a droopy face, or you can also have slurred speech, weakness or tingling in your limbs, one or two of them, that kind of thing, or you have difficulty word finding, that kind of stuff, right? Dysphasia, difficulty speaking, and all these are signs and symptoms of a stroke. As a reminder, a sign is something that is as objective, and a symptom is subjective, meaning it depends on the person's individual experience, right? And so the longer a stroke goes without intervention, the greater the chance of a permanent neurological damage. And that is because sometimes we can have what's called a TIA, a transient ischemic attack. Let me see if I can write that somewhere on here. Let me write that, ischemic attack. Let me write that. Give me a second to get a text box in here. Transient ischemic attack. Transient ischemic attack. That's one where someone experiences stroke-like symptoms, signs, and then it goes away. It's temporary. That's why it's called transient. It's temporary. The patient might wake up in the morning and they think, oh no, my right arm is weak, or my face is drooped, I can't really speak, I can't smile without having a crooked face. And then they go to the doctor. By the time they get to the emergency room and they've been rushed through the protocols, they get to the CAT scanning room. I'm fine now, it's fine, everything's good, I want to go home. Well, that's a canary in the coal mine, as they would say, because it's an indication that a larger problem is coming up soon. So this person will probably be put on some kind of heparin treatment or some kind of anticoagulant treatment, because the doctors will surmise that there was a temporary blockage or temporary interruption of blood-brain supply. Right? So transient ischemic attack is a temporary stroke, or one where a patient experiences the stroke-like symptoms over a short period of time and it passes. All right. Next, we'll talk about the meninges, which are just some membranes that line the CNS, and there's 3 of them. You've all heard of meningitis, which is an inflammation of the layers, that the triple layered membranes that protect the nervous system, and they got 3 layers of them, and they're from superficial to deep: dura mater, arachnoid mater, pia mater, DAP, and then we have the brain. They're very, very thin. So if you're looking at a cross section here from the bone to the brain, you can see the skin, the bone, then the meningeal layers, dura, arachnoid, pia, DAP. And their function here is to protect the brain. And so sometimes we can have bleeds that are named in relation to the meningeal layers. So you've no doubt heard of the terms epidural bleed or subarachnoid bleed. For sure, you've heard of that one. You've also have heard of subdural bleed. These are just bleeds named in relation to the meningeal layers. So an epidural bleed will be well above the dural layer. A subdural will be below the dural layer, and so on and so forth. And subarachnoid, right? There's none termed we call it epiarachnoid. That's redundant. It just goes epidural, subdural, subarachnoid. There's other bleeds also. We call it intracranial bleed, and so on and so forth. These are the more common ones that you would see on an indication for a head CT. And some of these, you can conveniently see that these are blue. Some of them are blue, some of them are red. The red ones are arterial blood, so the epidural bleed will be as a result of an artery rupture, typically the middle meningeal artery, and that's high pressure on the brain over a short period of time, so it could be devastating. Subdural is venous blood, usually of shearing blood vessels, right? But it's dangerous for sure, but it can be chronic. So sometimes you can have a subdural over a long period of time and you just think it's a headache, and it just goes and comes. And you eventually have a CAT scan, you realize you've had a chronic subdural for a long period of time. But this one is under high pressure from arterial blood flow. This one's under lower pressure from venous blood flow, generally speaking. And an intracranial or intracerebral hemorrhage is deep within the brain tissue. Here's a subarachnoid bleed. That can happen anywhere there are folds, in between the folds of the brain where there's subarachnoid space. And subarachnoid space, if you remember, is where, I think we spoke about this, is where CSF resides. So CSF is cerebrospinal fluid, and wherever there's CSF resides in the subarachnoid space, and you can have a subarachnoid bleed. So you can have a bleed in the ventricles, you can have a bleed right around the brain where the subarachnoid space is, and the CSF just kind of bathes or sits in this area. So that's where a subarachnoid bleed would be. All right, so let's recap that whole thing. We got 3 layers of the meninges: dural, arachnoid, and pia. And we have some bleeds that are named in relation to these three layers: the epidural, subdural, and subarachnoid, right? And then we have a deeper one that's not in relation to the meningeal layers, but it's called an intracerebral or intracranial bleeder. That's deep within the brain tissue. So the subarachnoid is wherever there's subarachnoid space. Within the subarachnoid space, we have CSF, which is cerebrospinal fluid. And with the cerebrospinal fluid, we can have brain bleed, right? The epidural is as a result of arterial blood flow usually. The subdural as a result of venous blood flow usually. And the subarachnoid, well, it could be either. All right, so continuing on, this is the last slide for this PowerPoint. CSF is used to bathe the brain and to carry nutrients and to remove impurities and so on. The CSF is made in the ventricles of the brain. There's these cavities in the brain. We can see on CT in a little bit. I'll show you. There's cavities in the brain that carry this fluid, and it's made by a structure called the choroid plexus. Choroid plexus. Let me write this. Choroid plexus. And these are in the ventricles of the brain and they produce CSF, cerebrospinal fluid. So you've no doubt seen a child or an adult with a very large head, and it's as a result usually of hydrocephalus, which is just excessive amounts of CSF in the brain, water in the brain, the layperson would say. And they put in a shunt to drain that into the abdomen. So you do, as you probably know, a lateral skull, probably a chest x-ray and an abdomen, just to make sure the shunt's in the right place and functioning as intended. So again, hydrocephalus is just an accumulation of excess fluid in the brain or excess CSF, because what's happening as it's created, it should be reabsorbed by the body. If it's either being if there's overproduction or it's not being reabsorbed as quickly, you can have an accumulation of CSF in the brain that causes hydrocephalus. Point of fact, for a child, the skull would look larger because the skull hasn't ossified, so it expands over time. For an adult, well, the skull is ossified. So if they develop CSF as an adult, the skull would not expand, but then would have a raised intracranial pressure, meaning the brain would be squeezed. In either case, the brain will be squeezed, but the major difference with the adult and the child, if you develop it as a child, your skull would expand. But as an adult, your skull would not expand because now the sutures and the skull has ossified. All right, very short. Let's get on quickly to the next PowerPoint before we look at some CT images. So the second PowerPoint, so it's gonna go over some of the stuff in quiz form probably and talk about some other things. All right, so looking at some CT images, we can see, well, this is obviously the brain, right? And so from the last few weeks, we've been talking about why things show up as white and some things show up as black on CT. And remember that white areas are typically denser structures, bones. So this is the skull, and we can see these dark areas in the middle of the skull here. We'll look at some other images shortly. And this is where the ventricles are. There's CSF in here. This is the lateral ventricle on the right. This is the right lateral ventricle. And this is the beginnings or the superior portions of the left lateral ventricle here. All right. And these are folds of the brain. If you recall that the cell bodies for the brain are on the periphery, generally speaking, and the white matter is towards the center. Right? So when the doctor speaks of gray or white matter disease, they're speaking of either these areas or these areas here. White matter is towards the center for the brain, and the body, the gray matter, is towards the periphery of the brain. Here's another shot of that. We won't look at this again. You can look at this at your own time and review that. All right, so the other thing you should know is when we look at the CT image, we can see almost little folds in here. And these are significant. These are little folds in here. And so here are the general terms that you will hear. So that's a gray matter towards the outside, white matter here. But then we have a sulcus, which is a separation between the gyri. So this is a gyrus. Each fold is a gyri. And the fissure is just a deep sulcus, like a huge separation. That would be a fissure right there. That would be a fissure right there, right? All right, so a sulcus is just a smaller separation, and a sulcus is a smaller separation, and the fissure is deeper between the gyri. All right. And so you should use a slide to try to recall the functions of these lobes. So they're on the first PowerPoint, but use this to test yourself to see if you can recall what I said or what was written under here. And just remember, these are guides, so general functions, right? And then use this slide to try to name the lobes, right? So you could just print it out or just practice calling them out. What's this lobe called? What's this lobe called? What's this part called? And so on and so forth. All right, and this just goes into an area. I think I mentioned this on the first. I did mention this on the first part of this video about some important parts of the parietal lobe. And we have the central sulcus right here. Central sulcus. Remember that sulcus. It's just a separation or a groove between the gyri, right? So let me find that. Here we go. The central sulcus it implies that it's in between the frontal and the parietal lobes. And so we have a pre-central gyri or post-central gyri. And one of these is important for the primary motor area. The other one's for the primary sensory area. Primary sensory area. So the two important parts of the brain here when it comes to primary motor area and the primary sensory area, somatosensory area. That's the pre-central and post-central, named after the central sulcus here, gyri. All right, so this just goes into not detail, but helps you to narrow your focus as to what each lobe does, right? So let's try to put this here. So the parietal lobe is for orientation. The temporal lobe we can say is for hearing, but not exclusively. But yeah, we can say it's for hearing. At the very least, you should know one of these functions, right? The occipital lobe we can say is for sight, right? And that's on the first PowerPoint also, and also the earlier part of this. The cerebellum is for balance and posture. And the brainstem, if you can recall, is for things that we can't control, like breathing and your heartbeat. All right, and the last bit of this that we should talk about is the circle of Willis. Now, the circle of Willis is how the brain gets its blood supply. Now, in the first part of this video, the first PowerPoint, we spoke about stroke and so on, right? And I said that a stroke is a temporary interruption of blood supply to the brain. So if there's a blockage in any one of these vessels, we can have an infarct or death of tissue or damage to the tissue due to the lack of blood supply. The genius thing about the circle of Willis is like a roundabout. So if one entrance to the roundabout is blocked, then the rest of the brain can still get blood, which is fantastic. So the circle of Willis gets its blood supply, if you're taking notes, from three vessels: the internal carotids and the basilar artery. And then that continues around almost in a circle like this. You can kind of see the circle right there. Not a perfect circle, but you get the idea. And that's how the brain gets its blood supply. We won't bother with the names right now, as require you to memorize it for this course. However, it's gonna be on one of your classes, I'm pretty sure. All right. So again, the circle of Willis gets its blood supply from three vessels: the internal carotids and the basilar artery. And that continues in the circle by communicating arteries. And this one here is a middle cerebral artery. That's the anterior cerebral artery. That's the posterior cerebral artery. And these are connected by posterior communicating and anterior communicating, respectively. Over here on the right, we can see which parts of the brain get blood supply from which blood vessels. So you can see them here. So if I should say to you, someone has a blockage to the anterior cerebral artery, which lobes would be primarily affected? That should be pretty easy, right? If I also say to you that there's a blockage in the middle cerebral artery, or a dense MCA sign, as they would say, which lobes of the brain will be primarily affected? I also say to you that there's an infarct on the left side of the brain, which side of the body would show a sign, or would show signs of a stroke, right? So you should be able to answer that really easily based on what we spoke about so far. And that is the end of this PowerPoint. Now we should spend the rest of the time looking at some brain images and some stroke images. All right, so this is a coronal image of the brain, and we can see, let me start with the axial actually. This is how you'd acquire these images. Let me move this over. We can see, let's start at the bottom. So typically we would start at the most inferior part of the skull and continue up. So again, if you can recall, the dark areas will be more radiolucent than the white areas. The white areas are bone. So these are the ventricles. That's the left lateral ventricle, anterior horn. And that's the right lateral ventricle. And that goes down. We have the third ventricle. And that goes down to the fourth ventricle. So we could find that right here, fourth ventricle right here. And those are, if you can remember, what holds CSF, cerebrospinal fluid, and choroid plexus is what creates the cerebrospinal fluid. Sometimes it's not white on CT, sometimes other times it's calcified. This is not what we're seeing here, by the way. It's a pineal gland, but sometimes it shows up as white at the base of these, but it's right in here. It's not named in here. Let me see if I could search for one of these. I don't think it's labeled in here, but here it is right here, choroid plexus, and that's where CSF is made. And let's look at some of the stuff. Let me make this smaller again. Let's make this larger. Okay, good. And so then we can see the same ventricles. These ones here, the same ventricles. With the dark areas, remember that's the ventricles. CSF is in here. These are the different folds of the brain, the gyri and the sulcus, right? Some other thing that you should know is the sagittal sinus. Superior sagittal sinus is here. That's where the separation of the right and left hemispheres. So you can see that right there, superior sagittal sinus. You can see that all along the axial image too, right along here, superior sagittal sinus. So as far as anatomy, what you should know for let me see if I could, what you should know for this class, you should be able to identify the ventricles for sure. You should be able to identify the circle of Willis. If I put an image up in class, you should be able to identify the brain lobes if I put an image up in class. And you should be able to identify the different planes of these scans, right? So that's a coronal plane, and this is a skull image. Let's make this smaller. That's a sagittal image. That's a sagittal image right there. So you should be able to name, okay, for example, the brain stem, the cerebellum, the temporal lobe, and so on and so forth, according to the diagrams that I've shown you on the PowerPoint. All right, so now let's look at some examples of CT imaging that we can see. So for this particular one, we have given contrast. You can see that the blood vessels are highlighted here because we've given contrast. So if we go to, for example, Radiopedia, CTA, head and neck, normal CT neck, let's do head and neck. Let's use this one. If we use, oh, beautiful, here we go, this is beautiful. Let's get rid of some of the stuff here, and let's make this a little smaller. Let's use these axial imaging here. We'll start from way at the bottom. We can see blood vessels coming up off of the arch of the aorta. Don't worry about that right now, but just know that these blood vessels are going to the brain. Common carotids here. It's going to bifurcate pretty soon. Right there's the common carotids. These are the jugular veins. And the common carotids are here. They're going to bifurcate right at the gonian, right about here. So you see where it splits in two to become the internal and external. That's going to be the external. That's the internal carotid. And remember I said that the circle of Willis is fed by the internal carotids and the basilar artery. Well, the internal carotids are here, and that comes up to the circle of Willis. That's a circular willis. That's a middle cerebral artery. And oh, that stops there. It's okay. And that's going up to the anterior cerebral artery right there. That's a circular willis, pretty much right there. That's a posterior communicating, and so on and so forth. Okay. All right. So if we look, and it says, so I said that the circular willis is fed by the internal carotids, 1, 2, and the basilar artery. That's right back there. Basilar artery is here. And the basilar artery comes up from the vertebral arteries here. These two join together to form the basilar artery. If you look at, let's use this one. So these are the vertebral arteries coming up here, and they join together to form the basilar artery, and that's what you're seeing here. So the vertebral arteries are in here, and they join together. You can typically see them right back here. This is the basilar artery that goes up to feed the circular willis. All right, so 3 vessels: the internal carotids and the basilar artery. At the very least, you should be able to identify this one. This is the middle cerebral artery right here on the left and on the right. You should also be able to identify the basilar artery. Easy way to see this one is on probably a sagittal image. You can see it right there next behind the sella turcica. So that's a pituitary fossa right here, and that's the basilar artery just behind it in the mid sagittal plane. All right. And the coronal image, you can see all the vessels. These are the jugular ones that are on the outside. These are the carotids on the inside, the common carotids here. And then that bifurcates right at the angle of the mandible. We call that the gonian. So you can see the common carotid here. If you follow that, it splits right about at the angle of the mandible, right there. And that's actually the internal carotid. It's a little strange because it looks like it's outside, but this one's gonna swing out. See how it swings out right there? And so the one that's actually was outside is now internal carotid, and that continues up, kind of wriggles itself through the petrous bone up into the circular willis and feeds the brain with its blood supply. All right, so that's what we're seeing here. So this is a typical CT stack of images for a CT angiogram of the head and neck, just to see if there's any deficit to the blood supply to the brain. All right, so we're going back to the knowledge check. We've discussed a bunch of things. Some of this you'll have to garner on your own. We're not going to feed you all these answers, so you got to look this up. But you should be able to list the brain lobes as per the PowerPoint, and some signs and symptoms of stroke also on the PowerPoint. Describe what the brain in fact affects the opposing limb. You should look that up. Outline the significance of a timely intervention. Well, we talked about this, inferred at the very least, and we defined the stroke and different types of stroke, and list the medical interventions that may limit or prevent a chance of permanent damage. So I kind of talked about it. I didn't talk about all of it, but you can figure out the rest of it. This is important stuff for your community and for your job. Going forward to next week, we will talk about the skeletal system, and then it's going to be Thanksgiving break. We'll have 2 assignments, and then we're back together. We will do the endocrine system and so on and so forth. All right, take care.